Did you know heart disease is the leading cause of death worldwide? But do you know what signs to look out for? Often it's an unfamiliarity with these signs that can turn a manageable situation into a severe one. Recognizing early warning signs of heart disease is not just important, it's a matter of life and death. Heart disease doesn't discriminate. It affects people irrespective of their age, gender, or lifestyle. It's a silent killer, often striking without warning. However, if we pay close attention, our bodies usually signal when something is not quite right. These signals, these early warning signs of heart disease, are our body's way of telling us that it's time to seek medical attention. The key to survival is knowledge. Understanding these signs can potentially save your life or the life of a loved one. So let's not waste any more time. Stay tuned as we delve into the 10 key warning signs of heart disease. The first warning sign to look out for is chest discomfort. This discomfort can present itself in a variety of ways. Some people might experience a sharp, stabbing pain, while others may feel an intense pressure, almost like an elephant is sitting on their chest. It could also be a feeling of fullness or squeezing. This discomfort can last for a few minutes, disappear, and then return. Remember, chest discomfort is a classic sign, but not the only one. Next up, shortness of breath. Imagine feeling like you've just run a mile, but you're merely sitting or engaging in light activities. It's as if your lungs can't quite fill up with air, leaving you gasping for more. This isn't a normal response to everyday tasks. It's more than being out of shape or aging. This could be your heart telling you it's struggling, that it's not pumping blood as efficiently as it should. Shortness of breath is a signal your heart may not be working efficiently. Fatigue and irregular heartbeat are our next warning signs. These symptoms might manifest in several ways. You may find yourself feeling unusually tired, even when you haven't engaged in any strenuous activity. This fatigue is more than just feeling sleepy. It's a profound exhaustion that doesn't improve with rest. An irregular heartbeat, on the other hand, might feel like your heart is racing, skipping beats, or fluttering. This is known as arrhythmia, which might be harmless in some cases but could also signal a serious heart condition. The potential reasons behind these symptoms are numerous. Fatigue could be due to your heart working harder than it should, trying to pump blood through clogged arteries. An irregular heartbeat could be a sign of a malfunction in the heart's electrical system, or it might be due to structural changes in the heart muscle. These symptoms might seem benign, but they could be indicative of an underlying heart condition. If you experience fatigue or a racing heart, it's time to consult your healthcare provider. Dizziness and sweating are also key signs not to ignore. When we think about heart disease, these symptoms may not be the first to come to mind, but they are crucial indicators. Here's why. Your heart is the powerhouse of your body, pumping blood to every corner to keep you running smoothly. When the heart is under stress or not functioning properly, it can struggle to maintain this vital circulation. This can lead to dizziness, as the brain may not receive enough oxygen-rich blood. Sweating, on the other hand, is your body's way of cooling down. When your heart is working overtime, it generates more heat. Increased sweating, even when you're not physically exerting yourself, can be a sign that your heart is under strain. These symptoms, dizziness and excessive sweating, might seem like common occurrences, perhaps after a tough workout or on a hot day. But when they happen frequently, without a clear cause, it's worth getting checked. These could be your body's way of signaling that your heart needs attention. Nausea and swelling, particularly in the legs, ankles, and feet, are also potential warning signs. Now you might wonder, how are these symptoms connected to heart disease? Let's break it down. Nausea could be a result of digestive issues, yes, but when linked to heart disease, it often comes hand in hand with abdominal discomfort or indigestion. This happens because the heart, struggling to pump blood efficiently, may cause a buildup of fluid and pressure in the liver, which can lead to feelings of nausea. Swelling, on the other hand, is often due to fluid accumulation in the body, a condition known as edema. This fluid buildup is often seen in the lower extremities, like the legs, ankles, and feet. When your heart isn't pumping effectively, it can't keep up with the body's demand, leading to fluid retention. These signs may seem unrelated to your heart, but they can indicate underlying issues. Finally, unexpected weight gain and a persistent cough can be signs of heart disease. Now you may wonder, how are these related to your heart's health? Well, here's the connection. Fluid retention, also known as edema, can be a direct result of a weakened heart. When your heart isn't pumping as efficiently as it should, fluid can build up in your body, leading to sudden weight gain. Moreover, this same fluid can accumulate in your lungs, causing a persistent cough. It's not your typical cough that comes with a cold or allergy. It's a different kind of cough that may produce frothy and pink-tinged mucus. It's an alarming sign that your heart might be struggling. So if you notice a sudden increase in your weight, especially if it's accompanied by a persistent, unexplained cough, it's important to consult with your healthcare provider. Even seemingly unrelated symptoms can be a signal that your heart needs attention. Now that we've gone through these 10 warning signs, it's important to remember how crucial it is to stay vigilant and prioritize your health. Let's take a moment to recap. We started off with chest discomfort, a common sign often described as a feeling of pressure, squeezing, fullness, or pain in the center of your chest. It may come and go, but it's something that should never be taken lightly. Next, we discussed shortness of breath. This isn't about being out of breath after a run, but rather feeling winded while doing simple tasks, or even when you're just sitting or lying down. Then we delved into fatigue and irregular heartbeat. Feeling unusually tired or noticing your heart skipping beats, racing or throbbing could be signs that something is not quite right. We also touched on dizziness and sweating. Feeling lightheaded or breaking into a cold sweat for no apparent reason can also be warning signs of a potential heart condition. We went over nausea and swelling as well. If you're feeling frequently nauseated or notice swelling in your legs, ankles, or feet, these could be indications of heart disease. Lastly, we talked about sudden weight gain and a persistent cough. Gaining weight without a change in diet or exercise and a cough that won't go away can also be symptoms of a heart condition. The vital thing here is to understand that these symptoms don't necessarily mean you have heart disease. However, they are signals from your body that you shouldn't ignore. If you're experiencing any of these symptoms, it's crucial to seek medical advice. It's always better to be safe than sorry. Heart disease is a leading cause of death globally, but it doesn't have to be. With early detection and the right medical care, it's entirely possible to live a long, healthy life, even if you've been diagnosed with a heart condition. Remember, early detection is key. Listen to your body, it knows when something isn't right.